Hey friends, Dr. Mary here with Dr. Kelsey. Yay! We're here at Integrative Health and Wellness. And we were just talking about, because my son has autism, and I found you guys and didn't even realize that you specialize in autistic kids and all neurodivergence. And tell us a little bit about your story and how that all happened.
So, I didn't know I was going to specialize in autism and neurodivergence either. Um, it kind of happened more when I had kids because I always dealt with anxiety and stuff like that for myself. But I had a son, my first son, his name is Caden. He's awesome, but he is very much ADHD, like very, very high ADHD. And I knew from the age of probably 18 months. It was very evident. And I dealt with a lot of things with my family that they were like, you're just, hey, boys will be boys, it's normal, it's okay, he'll calm down once he's in school. And we dealt with a lot of that. And then it became like, you need to cut out dyes and stuff like that, which we had already done. They ate a very healthy diet and they were really good compared to most kids. Like, they don't drink sodas, they don't do anything, so we're doing everything right. And then we got to about school age where he was going to school, and then he started struggling in school. And it's like, oh, okay, he does have ADHD. There is something going on. And then we were getting notes from the school every single day, and it just became so stressful. And everything was like, he needs to be on medicine, he needs to do this. And I was so dead set against that because for myself, knowing now that I also have ADHD, it's not just anxiety. I was on medicine from the time I was probably 8 years old. So I was on medicine before I hit puberty or anything like that. And it's something that I was dead set that I was not going to do that for my children. That doesn't mean that it's not right for everybody. There are times if he was failing school or something like that, there was things that we kind of decided that we might change if that were the case. He wasn't failing, he was just struggling, and that's a different scenario. So we got closer to that time, and then my family kind of flipped their switch of like, this isn't normal, you should medicate him. And so I was getting pressured no matter what way I did it. So I decided that when I went into chiropractic school, that's what I wanted to focus on, is calming down the nervous system and kind of settling that sympathetic response that they continuously have throughout their body, rather than them being able to regulate themselves, because they just can't do it. So when I got into my upper quarters, because we had quarters, we didn't do trimesters, we talked a lot about pediatrics, which is when I found out that that's really kind of something I wanted to do, because I've always wanted to be a doctor, but I didn't want to do the medicine. And so I wanted to focus on something that was more along the lines of like natural, like how can I help without having to use medications, because I've always been on medications. It's not what I want to do for my kids or other kids. Like, how can we keep them well rather than wait till they're sick and then be like, here's all the pharmaceuticals for that. So I was really, really lucky. We picked mod docs via lottery. I'm never good at it. I'm not good at lottery. But I was actually like fourth picked, and I got into an amazing mod doctor. Her name is Dr. Ferranti. She's fantastic, but she focuses on pediatrics and she focuses on pregnancy. And it was like, this is what I want to do. And so I spent 9 or 10 months with her and just learning everything I could about craniosacral therapy and dealing with neurodivergent kids, and how she did it and with such grace and such help. And I knew that that's what I wanted to do. So when I came back home, I knew I was always going to come back here because there was no chiropractors who did that. And so it was something that was really close to my heart. I wanted to give back to my community and my schools that I went to and things like that helped me get through my toughest times, and then treat that population and give some parents an alternative and some hope, rather than like being bullied into what they weren't comfortable with, which I feel like that's the majority of what people do, is bully the parents into like, nope, this is your only option. And that doesn't have to be the case. There's always like, adjunct therapies that we can do, and sometimes there is medication that's needed, or sometimes there's something that like occupational therapy and feeding training and all the other stuff that they offer, but there's also some other things we can do too. So I like to work with that realm of people to like help our patients as a whole and give them a community and a village to help them, rather than go to your doctor and they'll prescribe you your Adderall or whatever medications they're going to give you to kind of help. And it just, to me, it doesn't always have to be like that. And seeing the joy on the patients and the changes that I'm seeing and their parents even, that stress just kind of come off, where it's like they can come in here and act however it is they're feeling that day and have their emotions and not feel like it's a scary place to be or they're being judged, is something that's very, very important to me. So that's how I kind of got into this and how I developed what I'm going through and what I'm dealing with my own son. I see it, and I can sympathize with patients and parents and know that they're not doing these things on purpose, or it's not just a behavioral thing. It's a neuro brain body connection that's just not working properly. So it's really gotten me into that, and it's helped me help my community in the area that they just don't know what else to do, and I love that.
It's really amazing too. I mean, I have watched how many different clients that you see, you know, from older teens or even adults who are neurodivergent or autistic, and then, you know, young babies, just
we see them days old to
yeah.
I think my oldest patient's 99, and like they still had some of those things going on too that just never got diagnosed either. So it's also giving them validation that, like, even especially females, I think that happens a lot, where they just think that it's anxiety or there's something else. There could be something else that's going on, and they get dismissed, and it's just something else. And to me, that's just a write-off. Like, they're just not willing to look into what's actually happening or what can actually help them. And if the doctors don't know, which comes up especially with what we're going to go over today, like, where they just don't know what to do with those results, they don't know how to fix that, so that's not an option, or they downplay it. And it's like, I've seen the results from it. I have done this for myself, and I've seen the results with it, so I know it's something that actually can help people significantly, and it's non-invasive.
Right. So starting with chiropractic for the nervous system, so balancing so the nervous system can regulate sympathetic and parasympathetic, you know, the fight or flight, and then
which is also important. You want to have both. But with a lot of them, that vagus nerve especially is something that plays a big role. And I was talking to a patient today, and they're doing some therapy, and they're really stimulating that vagus nerve, and he's being sick all the time. So it's too much. So it's just an understanding of the balance rather than just, okay, they're in that, let's stimulate it. It's not always good either. You have to do it on a case-by-case perspective rather than one size fits all. It just doesn't work that way.
So I love that too, because here you guys do a variety of different therapies. From when my son came in sick the other day, and you know, all the lymphatic decongestant you did for him. You have a whole line of supplements. We're going to talk about the GI test in a second. And then we met, and we brought in Young Living essential oils and stuff.
That's been a big thing too.
Yeah. What have you loved about Young Living oils?
So I love them. When I was in chiropractic college, I started with them for practicing for my boards, and somebody had explained the connection to, like, if you're studying for something, use a scent and then use it while you're doing that actual testing, and it correlates in your brain, like that way that it works. So if that works that way, that means there's other ways that can also help. So like if you're stressed and you associate that oil, like I use this for stress or whatever you associate with, it helps significantly. So, but with my patients in general, so I have POTS, which is there's more research coming out that it's also a central nervous system, not just a parasympathetic issue or an issue with your autonomic nervous system. It's both. So now I'm learning that there's a little bit more to my spiciness, but my heart will race, or I'll get sick all the time because that vagus nerve, it's similar to what happens with the kids, is it just goes crazy, which is why it's diagnosed as anxiety so frequently, is because it looks like a panic attack. Your stomach hurts, you feel sick, you don't digest your food properly, you get nauseous, you throw up, sometimes people faint. There's just so many symptoms that encompass it, but it's always been anxiety. So I was at my last leg because I had been through so many different doctors and so many people that just wrote it off, and like, oh, if you just eat more. I had also lost a lot of weight. I was probably 113 pounds at 5'7", which is extremely underweight for me, and I was still working and functioning, but I wasn't functioning, not at my best and not what I could do for my patients, and I was just trying to get through the day. And it just I just remember texting you. I think you had helped Dr. Tom after he had a cold that was going on, and you helped him. And I was like, Mary, please help me. Like, what oil? And you're like, well, let's see what your body actually needs. And I'm like, can't you just tell me an oil? Like, it's going to fix all my problems. And it really wasn't that easy, but it is that easy because it's not that we don't have them. It's just like what's going on in our body right now. And with POTS, it varies so much throughout the day or even throughout the week or month when you have cycles and everything else. It's hard to determine what your body needs at that given time. I have my given oils. I have my digize that helps me significantly with my nausea. And anytime I get nauseous, I get anxious. So I correlate that with my anxiety. So I did that when I was younger as well, but except they were giving me Pepcid, which is fantastic. I was like, if I take this, it'll make me feel better. So I do the same thing with my digize, or I do the same thing with my Citrus Fresh, or the Kids Power I like a lot too for my ADHD. It just helps calm my body down, and I realize, okay, we're using our tools, we're using what we can, and naturally your body's going to calm down. Does it take care of everything all the time? No, but it makes it manageable. And if I can make it manageable, then I can get through life a lot easier rather than like, this is the way it is, there's no getting better from this. So I appreciate that more than anything about the essential oils, is it's just another thing, and it's not a pharmaceutical or something that I have to take more of, because my goal is not to be taking anything. I don't want to need that. I'd rather need something that I can put on anytime I want it, you know?
Yeah. Well, what I love too about here in the office is you guys have diffusers in every room.
Yes.
and for the parent, because I know from a child who doesn't always obey,
Yes.
that there's just a lot of anxiety when we bring a child, or we've been arguing in the car or whatever it is. So to come into your room and just be like, at peace.
And everybody loves the owl diffuser too, because it plays. I always play the music in there too, so it's very like soothing. And the parents are just like, and I'm like, do you need a nap? Like our room is very big. I don't know if anybody's seen it. It's very big, and there's lots of toys and everything for the kids to play. So if mom and dad can kind of relax and know that nothing in there is going to get broken, that's not meant to like have harm to it. So there's not a big deal if something happens, but it just gives so much peace and so much calming energy. And they can, like, a lot of my kids now, they're like, if they get overwhelmed, I'm like, what do you want? Do you want to try a scent today? Like, do you want to smell something? Like, I think this might help. And then sometimes they're like, oh, no, I don't like that one. We pick something else, and they eventually find something, and you will drastically see a change in their demeanor by the time that they leave with an adjustment, and then just having that oil put on the bottom of their feet or on their spine or whatever it may be. But it's a significant difference between, like, just doing the adjustment is very effective. It really is. But adding something else to it, another modality or therapy or oil, only intensifies that, and it lasts longer. So the goal is to give parents a little bit more peace, the child more peace, because believe it or not, that's just the hard part, is like, they're not doing it to hurt you. And I think a lot of people from the outside will look at it and they're like, well, if they would just do this, then they wouldn't do that anymore. It's not. It's not it. It doesn't work that way. And if you look at it that way, then you're really just shaming that parent, and that brings them more things too, and that's hard. Because you can't always control everything that happens around them. They don't know how to regulate their emotions. So if we teach them that it's okay, using their words and using modalities such as oils to calm their body down so they can express their emotions, then that brings down the level of your anxiety, which they come off of ours, whatever we're feeling, they feel. So if we're using it and they're using it, then that puts everybody in a really good space to where we can have proper communication and settle those nervous system down significantly.
This is such a good point too, because like, I come from the essential oil world. So yesterday was a stressful, and I just took that stress away and had him put it on him, and the whole car was better. But one of the things that we have been doing is frequent adjustments. Is weekly adjustments, and when I really think about it too, there is definitely a difference, because we skipped last week.
We did.
And
I didn't even think that.
And so this weekend we definitely had more outbursts, sleeping issues, and things like that. So the frequency of balancing the nervous system, I think, is important.
Right. And it's not the same for every child either. Everybody's super different. but Josh does respond very well to being adjusted, and like he wasn't so into it like in the beginning, and he was very timid, but now he comes in and he tells me his whole life story that day and what happened at school, and it's just a really cool calming experience for him to come in and get treated. It's not the stressful thing. Like, I'm not going to make your child lay on the table if they don't want to. If they want to be adjusted in the tent, we're going in the tent. You know, like whatever they feel comfortable with. And I always tell patient parents, like, I'm a very consented doctor. If they say no, we're not doing it that day. Because even if you want it done, that's fine, but I want them to trust me and know that I'm only here to help them. If there's something serious going on, I'm going to say, like, this is important today. But otherwise, it's very much like, I want you to know that you're safe here and that your voice is heard, and I hear you, and I'm not going to force that on you, because they're used to everything being forced upon them too, especially that population. It's like, no, you have to do your OT, you have to do this therapy today. Not here, you don't have to. We can just play for a little bit and we can talk and figure out what's going on, and usually they'll calm down and they'll let me do what needs to be done in the long run anyways. But if they don't have that rapport or that confidence to be able to speak up and say they don't want something, it doesn't work. You can take them anywhere and it won't work.
And that is what makes this office very different too, you know, and why people travel hours and hours
they do.
to come to the office too. And so another, I wouldn't say therapy, but another piece of the puzzle that you do. Let's just explain what it is, and then we'll do a separate video for going through it and stuff too.
So we do GI mapping. This is a really common one. It's actually covered by insurance. So that's how it's really well endorsed. It's not covered by all, but the majority do, which is hard and almost alarming that more doctors don't do it, because if it's covered by insurance, as I hate to say it like this, that usually means it's not just a functional medicine type deal. That means that it is respected among the medical community, that this is valid information that can be seen. So GI map testing is basically a 6-page report about what is going on in your gut. It gives you pathogens, it gives you your bacteria, whether it be good or bad, because remember, there is a balance you want to have, whether it be good or bad bacteria. If it's too much, it's too much. It doesn't matter if it's like good stuff, it just is. So if we're not taking care of ourselves and our GI, and we all know that gut-brain axis and that communication that we have, that
not everybody does.
That's true. I should not assume. There is a very strong correlation between what's going on in our gut and what happens in our brain. That's where a lot of our dopamine, our endorphins, all those things are made in there. So if we don't have that in a symbiotic relationship, or a relationship that's going balanced, we're going to have some disruptions in our emotions and our bowels and our mood overall, our adrenal glands, the cortisol, our sex hormones. It affects the weight loss. It affects everything. So if we're not paying attention to our gut, and we're in a population now where there's so many people that have gut issues that it's just normal to have diarrhea constantly, or to be constipated for 5 to 7 days. It's not of the normal to go to the bathroom every day. So when I ask patients that they're constipated, they're, no, I go 2 times a week, and I'm like, that's constipated. And then they tell me how long they're sitting on the toilet for too, and it's like, this is not normal. This could be better. Or they're going to the bathroom and they're getting diarrhea frequently. This is not normal. And even though they're saying this is stress related, this is IBS, that is a cop-out. I don't know how to say it nicely. It's a cop-out because they don't know what to do for it other than give you a prescription. And those prescriptions have side effects. So we're looking at more and more problems down the line of, now, why are we having so many GI cancers in such young people? And that's on the rise. And it's insane how many 20, 30-year-olds. I have had 2 friends that I graduated high school from that have passed away from colon cancer. And I'm 33. So that's crazy to me that we're having this many problems, and even them getting colonoscopies at the age is even harder. Not that I condone colonoscopies so much either, because that's wiping out your gut too, but they're not even getting that kind of care. It's like, okay, well, it's stress related. So here's the medicine, or deal with it. Take your Imodium, take your Miralax if you're constipated, which that's a whole other thing. But there's so many things that they're telling them to do that's just not appropriate for that diagnosis. It's hard.
And this really can get to some of the roots.
Yes, and it tells us too if we're dealing with like an IBS like situation, because the IBS is just irritable bowel syndrome.
Mm.
It's just a syndrome. It's not a diagnosis really. It's just saying you have an issue with your bowels.
Mm-hmm.
Thank you. I know that because I'm in the bathroom every day. You know, like that's not giving us any information. But it does distinguish between IBS and IBD, which is Crohn's, colitis, diverticulitis, colon like cancer type situations happening as well, which is super important because those two differentiations could we have cancer later on in life, or are we just dealing with something that's a dysbiotic gut? And that's a big difference, because if we have one compared to the other, we're looking at something that's a little bit more serious where we can fix things. We can still fix the other things, but it's going to take a little bit more time because something's been growing there for a while.
So this test can show you the difference between the two?
Yes, because it does calprotectin, which is the gold standard for IBD. So that's globally well known that is the only way to determine gold standard, how we can determine if something is IBS versus IBD.
Who would this be good for? I know in the autism community.
The autism, because they tend to have a lot of GI issues. Like, it is a well-known thing. I don't think I've ever had one that's literally come in with, I don't have any gut issues, whether it be like the nausea, the food aversions, the constipation, anything like that. Like, I've seen that all of the time. But not just then, like even with my POTS and stuff like that, like it tells us what's going on in my gut. Why am I getting so nauseous? Now there's some physiological things that happen with POTS that can cause some of that, but mine's gradually decreased. Like I said, I'm now at a healthy weight, whereas I was 113 pounds. And that was just changing this, using oils and things like that, and then getting back on a normal eating habit and learning my body better. But this is good for people who have crazy acne on their face.
Yes.
This is great. That anything on your skin, guys,
any skin issue
is a reflection of what is going on in your stomach and your GI. It literally, every time I see it, I'm like, you either have food sensitivities, you have some kind of dysbiotic gut, you have an yeast overgrowth, psoriasis, eczema. I don't care what we're talking about. There's something going on in your gut. So it's such a wide, vast majority of individuals who would benefit from this, especially with the food that we consume in this country, that even if you eat the healthiest of diets, it doesn't mean anything, because if your gut's been inflamed since you were born, remember, we get everything from our mom. So if our moms weren't healthy when they gave birth to us, which is
C-section, I was a C-section.
C-section, you're not getting the vaginal flora that they pass through. You're not getting any of the good stuff. Or if they had strep B and were given antibiotics while they were in labor, or if baby came out and they were dysregulated just from being stuck in a position for a really long period of time, lots of cervical checks. That's introducing a lot of bacteria into that baby, and it just causes so many issues that if we can get ahead of it, which is why I like to treat kids a lot too, their histories are a lot less. I can find out what was going on with mom, help mom too, and help baby. Or teenager, however old they are, and help them figure out, okay, you weren't healthy when you were pregnant, you had these issues, so we passed on that same gut flora to baby. Therefore, especially if they breastfed, which is good, I prefer it, but if their gut bacteria isn't good, then they're also not passing on the best stuff either. So it's hard. It's like breastfeeding is, in my opinion, better, but at the same time, is mom healthy when she gives birth? So it's really good to get that taken care of if you're looking into fertility and you're trying to get pregnant. It's good to take care of your gut so you give your baby the best chance too. So when I say it covers a large majority of people. It really does, because if you're trying to plan pregnancies and you're trying to have healthy babies and grow healthy families, like, this is the way you can do it. Even if you have the genes that are not happy and healthy, I don't have good genes for GI stuff. If I do the stuff that I need to now, I can prevent this from happening to my kids later on, because I know how to help myself. I can do this on my kiddos to make sure they're doing better and make sure that they're not going down the same path, and we can turn that gene off.
Yeah. It's so powerful to be able to know, and I think Netflix just had a really good documentary or something like that about health.
Yes,
and
I just saw it.
Did you?
I did. I just watched it.
Yeah,
I saw it.
what
I
it's
saw it over
called.
the weekend.
Yeah. But it literally, like, how what's in your gut affects your mood, your, and inflammation too, and pain.
Huge. And that's a big part of, like, people come in and they think that they're just heavy or they're overweight. And a lot of times, yes, it is the food we're putting in our mouth, but it's inflammation.
Mm-hmm.
It's not necessarily that they're like, I don't eat anything. That's part of the problem.
Mm-hmm.
That's a different story. But if we're not feeding our body the proper foods and our gut flora is all this, it's a mess, we're not digesting the food anyways, or the supplements we're taking. If we're not making sure that our gut is actually absorbing them and digesting them and breaking them down, you're just paying for really expensive poop and pee. Yeah. Depending on if it's water soluble or fat soluble, but you're just paying for and they'll say it doesn't work. It doesn't work. It does. There's something else.
Yeah.
There's something else.
Yeah, absolutely. Yeah, I mean, there's so much that you all do here, and have for the GI map. I know is your baby, and
I love it. I love it.
Stuff like that. So, and we're working on that. You may not even have to come to the office.
Correct.
That people could get a consultation with you and be able to do their GI maps at home.
Yeah, it's easily sent to their house anyways. Yeah. They have been sending them to our office as well, but we can send them to their address so that they can actually get it straight sent to their house. They send it to FedEx, and I get the results in 7 to 10 business days. So, awesome. Like, it's not like you have to wait months and months to get better. Yeah. You can start getting better pretty quick.
Yeah. So if you want to see a full GI map, we're going to record that. You can probably watch that. We'll put it in the description as well too. But thank you so much for telling us all that you do, because so many people think like, oh, I bet to a chiropractor, but there's it's like 200 different types, and really love what you do here and offer our community for autism, for babies, for pediatrics, for moms, for women, for everyone.
Yeah, so, it's fun. I enjoy it.
Awesome. Thank you so much.
You're welcome.